I'm Edward Yang, the Chief of Orthopedics at Mount Sinai, Queens. I came here to start a general orthopedic practice. Before I was taking care of a busy level 1 trauma center, and here I wanted to take care of patients on a more personal basis. I usually tell patients what the risks and the benefits are, what I can achieve, such as 95% pain relief. However, there are risks, and a patient has to balance those risks with what we can achieve in pain relief, and they will know. Usually I tell patients, you will know when you need surgery. You'll come almost begging me to do the operation. My office is in a new ambulatory pavilion. It's called Mount Sinai Doctors, where we have a multi-specialty group of physicians. Here at this building, we can do our imaging, X-rays, CAT scan, and MRI all in the same building. We can get any blood work that we want done, typically the same day. You can see orthopedic surgeons and even other surgical subspecialties in the same building. We perform a variety of joint replacements, mostly hip and knee replacements at Mount Sinai, Queens. It's one-stop shopping. You come to the hospital 2 to 3 weeks before your operation to get your blood tests, EKG, chest X-ray, and see the medical team before surgery. You get a joint replacement education class taught by rehab and nursing. It's a full team effort to make sure that the whole process is seamless and routine for each patient. We have house officers and PAs, we call them, taking care of the patients. They're on the floor with you all the time. They work with the nursing staff to coordinate your rehabilitation, to make sure your medications are given correctly, to help interact with the social workers to make sure your discharge is smooth. Most of the time, we try to discharge our joint replacement patients to home. This requires a coordinated effort between visiting nurse, the social worker, and the doctor's approval of the rehabilitation after the patient goes home. Typically, a patient will get a nurse come to visit them the day after they go home. They will make sure that there is rehabilitation or a physical therapist coming to the house 3 to 5 times a week. There's a number to call if they have any problems with their care. There's a nurse that calls you to make sure you're getting good care. So it's a coordinated effort to make sure that the whole experience is a quality one. I'm very proud to work at Mount Sinai, Queens. This hospital has achieved magnet status due to its outstanding nursing staff. It is the only hospital in Queens that has earned this recognition. This recognition is only given to a very small number of hospitals in the entire country. Mount Sinai, Queens is part of the Mount Sinai health system. We are providing a joint replacement operation that is going to be standard throughout the system. In other words, the length of stay, the type of operation you receive, the rehabilitation and discharge planning is all done similar in all the Mount Sinai institutions. I think our patients feel that we are providing the very best care that we can for them, and they can feel that. It's tangible. Our nurses and every member of the staff of the hospital is committed to patient care, patient safety. We have outstanding patient satisfaction scores. I can honestly say I don't think I've ever worked at a hospital where we're so committed to patient care as I have been at Mount Sinai, Queens.